According to the National Institute of Health, selective serotonin reuptake inhibitors, or more commonly referred to as SSRIs, are the FDA-approved class of medication most often used as a first-line pharmacotherapy for numerous psychiatric conditions, including generalized and social anxiety disorders. This is due to their safety, efficacy, and tolerability. The popularity and widespread use of SSRIs is due in part to their relatively fewer side effects when compared to commonly used antidepressants of the past. They are approved for use in both adult and pediatric patients. As the name suggests, SSRIs exert action by inhibiting the reuptake of serotonin, our brain's happy neurotransmitters, thereby increasing serotonin activity. The therapeutic actions of SSRIs have their basis on increasing deficient serotonin that researchers postulate as the cause of depression and anxiety in the monoamine hypothesis. Current SSRI medications used in the United States come in a variety of generic or brand name options. Generic names often end in TINE, like fluoxetine, which goes by the brand name Prozac, or have a PRAM ending, like the drug citalopram, which is branded as Celexa. SSRIs are only available orally and come in multiple forms such as tablets, capsules, or liquid suspensions. There are currently no parenteral or rectal formations of this medication. SSRI administration is typically once daily in the morning or at nighttime and can be taken without regard to food. The effects of SSRIs may take up to 6 weeks before the patient feels the treatment. Increased tolerability compared to other classes of medications make SSRIs a first-line option for their indicated uses. Although relatively safer due to their selectiveness for serotonin, SSRIs are not without risk. In 2004, the FDA issued a black box warning for SSRIs due to the possibility of increased suicidality amongst pediatric patients up to the age of 25. Therefore, all patients under the age of 25 should be continually assessed for suicidal ideation and other unusual behavior, as highlighted on the FDA black box warning. Common side effects from SSRIs include sexual dysfunction, sleep disturbances, weight changes, dizziness, decreased salivation, headache, and gastrointestinal issues. SSRIs also have the potential to prolong the QT interval, which can lead to a fatal arrhythmia called torsades de pointes. For patients with cardiac risk factors, an EKG may be an option to monitor for QT prolongation or arrhythmias. To mitigate withdrawal syndromes when choosing to discontinue SSRIs, guidelines recommend short tapers of between 2 weeks to 4 weeks down to the therapeutic minimum dose or half minimum dose before complete cessation. SSRI overdose is relatively infrequent due to their increased safety profile and tolerability compared to other classes of antidepressants. SSRI overdose is rarely fatal and usually does not have serious consequences. It is important to note that out of all the SSRIs available on the market, it's Celexa and Lexapro that are more likely to cause serious overdose issues, which is due to the differences in their structure. Both of these specific SSRIs carry an increased risk of cardiotoxicity due to QT prolongation. Serotonin syndrome is a life-threatening consequence of increased serotogenic activity. It can result from overdosing on SSRIs or from combining multiple medications that increase serotonin levels. Serotonin syndrome is characterized by mental status changes, autonomic dysfunction, and dystonias. Findings may include agitation, tachycardia, hypertension, hyperthermia, hyperreflexia, tremor, nausea, vomiting, and clonus. There is no definitive treatment for serotonin syndrome aside from discontinuing the offending agent, supportive measures, and benzodiazepines for agitation. Your primary care doctor or psychiatrist will need to prescribe and monitor your use of SSRI for treatment of anxiety disorders. The Student Health Clinic can help you navigate this and see if it's the right path for you. Screenings discussed in the brochure, such as the GRAD-7, can help guide your clinician on appropriate treatment. College, especially nursing school, can be a challenging time with many anxiety-inducing tasks. SSRIs are part of the toolbox to help better manage anxiety disorders.